Hello, I'm Dr. Kaplansky from ZAGA Center Buffalo-Rochester, also Smile 24 Center. We specialize in full-arch dental implants and severely atrophic jaws and placing zygomatic pterygoid implants and helping patients with their missing teeth. In this video, we're going to talk about how long it takes to get dental implants and what factors affect healing and how patients can help speed up their dental implant treatment. So we often get asked how long it takes to get dental implants. It's a very common question patients ask. With advances in modern dentistry and modern implantology, the time from start to finish has been shortened drastically over the last few years. So the process that used to take 6 to 8 months now can be literally done within a couple of months. So the procedure itself can take up to an hour or two per job, and the time from no teeth or broken teeth or missing teeth to teeth is literally within 24 hours. So within a few hours, you can have teeth. So the process is very simple. It all starts with a consultation. So the patient comes over, we discuss all the treatment options. Once patient and us decide on which way they want to proceed, the next step is what we call records. So we gather photographs, digital scans of the face, of the teeth, of the mouth. Everything is put in the computer, and then we come up with a treatment plan or treatment proposal that shows us where the implants are going to be placed, how many implants we're planning on placing, and we approximately design the teeth that are going to go on those implants in the computer. Then the next step is surgery. The surgery is 1 to 2 hours per job. So if we're doing a full mouth, upper and lower, it can take maybe 4 hours. After that, the patient gets their transitional or healing teeth, temporary teeth, and that's what they heal with for 2, 3 months usually. At that point, we start the process of designing and trying in the final appliances or permanent appliances. They are made of a much stronger material called zirconia, and then the appliance is delivered. So the whole process from start to finish can be 3, 4 months. Getting from no teeth to implants is shortened already quite a bit by utilizing all on 4, all on 6, we call all on X techniques, where multiple implants are placed and then connected together for what's called cross arch stability. So by connecting multiple implants together, we are able to load these implants immediately and not wait for them to heal, which is historically what had to happen before. So that drastically shortened the treatment time, and patients can literally get teeth in a day. Dental implant process is more of a partnership between a patient and a surgeon. It's not just something that we can do for you. You have to also participate actively in the process. And by participating, I mean following all the instructions. There's very clear and precise directions usually, and as long as they're followed, we succeed. You get a good result, and everything is done to your satisfaction. So specifically, what we recommend is patients adhere to a soft diet that involves foods that can be broken up on the plate with a plastic fork. That we call it a plastic fork test. So if you can break apart your food on a plate by using a flimsy plastic fork, then you can eat that food. That is done for the healing period of a couple of months. And another thing is keeping the appliances clean. So initially, there's going to be some restrictions on that because we don't want the sutures to be disturbed. So, but after a few weeks of just rinsing, you will be switching to using electric or power toothbrush. And then we recommend using water pick, but in a very specific manner. So there's tricks to how to use water pick and not to damage things. And then as long as you stick to your diet, as long as you continue to keep the appliance clean, as long as you don't smoke, smoking is very bad for dental implants, we succeed. Dental implant procedure is affected by multiple factors. Some are controllable and some are not. Uh, the controllable factors are again the quality of the surgeon, the caliber of the surgeon. So you have to make sure that you seek a specialist who knows the procedure and does it well and does a lot of it. The controllable factor again is patient's behavior. So you can eat soft food, you can keep the appliance clean, you can quit smoking. These are all things that are controllable. Then there's some factors that are difficult to control, such as bruxism, for example, grinding and clenching. So patients do that, and that can affect the healing of the implants. So we try to manage it with night guards, with maybe Botox injection, but it's a very problematic thing when people brux. Another thing is just general health of the patient. Patients with diabetes, patients with hypertension, patients with other systemic diseases like rheumatoid arthritis, patients on bisphosphonate drugs for osteoporosis. These factors affect implant treatment, and they may or may not be controlled by us or the patient. So we see a lot of patients with severe resorption, the patients that have had either no teeth for a long time or they've had dentures for many years, or periodontal disease destroyed a lot of bone. So patients present with a very deficient bone in the jaw, and they were told by other dentists that there's nothing they can do for them, that the patient will pretty much have to wear a denture for the rest of their life. We see a lot of these patients, and we now can help them because we have the technology, we have the ability to place implants in what we call extramaxillary fashion or location. So we place implants outside of the jaw, and it's placed into a solid native bone that doesn't go away over time. And that bone is located in the cheekbone area, in the zygoma, and there's also implants called pterygoid implants. They're placed into a cranial base behind the upper jaw, and that again is a very solid, dense cortical bone that doesn't go away over time. So, with the advancements in technology and our training and procedures, we can now help a lot more patients. And patients that were previously denied care now are able to get permanent teeth just like anybody else. So, as far as the healing and the process for placement of pterygoid and zygomatic implants, they're not much different as far as the healing goes. Once the implant is placed, it's connected to other implants and loaded literally within 24 hours. It's absolutely possible to get same day teeth using zygomatic and pterygoid implants, and that's what we do routinely. That's what ZAGA centers are so good at teaching this and promoting this treatment modality. And we do it pretty much every day. Osseointegration is the process of bone sticking to the implant surface, if I wanted to oversimplify it. And it's extremely important for the bone cells to adhere to the implant surface in order to lock the implant in place so that the implant can be used to attach teeth to it. So osseointegration is important in any implant placement, whether it's regular implant, zygomatic implant, or pterygoid implant. And the factors that affect osseointegration are there's systemic factors. So again, patients' medical health can affect that. Patients' medications can affect that osseointegration, and also what patients do or don't do with their implants. So, for example, smoking is very bad for osseointegration. It hurts the healing. Another thing is again eating uh, foods that are too hot or crunchy or sticky causes micromobility of the implant, and then that mobility during healing will prevent osteointegration. Immediate loading is possible in almost every case. We place implants daily and immediate load 99.9% of them. So the factors that affect immediate loading are stability or what's called primary stability. So if the implant during placement can achieve a certain degree of primary stability, which is measured in Newton centimeters, if we can achieve a certain number during placement of that implant, it can be loaded. But when multiple implants are placed and they're connected together, that changes these numbers to even a better outcome for the patient. Because even implants with less a degree of primary stability, when connected to other implants, can be loaded immediately. When placing dental implants, there's two main categories of dental implants, and they're distinctly different. There's single or individual implants for replacing individual teeth, and there's full jaw or full arch implants that are connected together and they replace the entire jaw of teeth or the full arch of teeth. And the surgery is different and the healing process is different. For individual implants, if the implant is placed with sufficient primary stability or sufficient torque, it can be loaded immediately and the patient can a lot of times have a tooth placed on it. But a lot of times for individual implants, they are left without a tooth, without loading, for a few months for the osseointegration to happen. So the bone has to stick to that implant before we put that implant in function. For full arch implants or full mouth implants, that is slightly different, and it's actually better because by sharing the load with other implants and by connecting implants to one another, we can shorten the treatment time, and these implants can be loaded virtually immediately, either at the same time during surgery or within 24 hours, which is still immediate load. There's a lot of things patients can and should do to help achieve successful outcome and shorten their treatment time. The most important things that patient can do are stick to soft diet, uh, keep the appliances clean, don't disturb the sutures, quit or slow down their smoking, and manage or control their bruxism if there's any. So patients that grind and clench, they can also affect healing of the implant. So all these things are very important. Another thing that's important is nutrition. So we always kind of forget about this, but it is important. So healthy levels of vitamin D and calcium in the diet are very important for bone healing. And when we work with implants, we work in the bone. So patients need to have good, nutritious diet full of vitamins and minerals to help speed up their healing.